When I use the HALO90, there are various things that I am very careful about. First of all, when I intubate the patient, one has to remember that the HALO90 device itself sits on the anterior side of the endoscope. And then as you go through into the pharynx, it will tend to try and enter the vocal folds, which is definitely not where you want it to go. So what you have to do is to angle the scope so that you're actually angling it backwards, and then as you go through, you just flip it forward so it just goes through the cricopharyngeus. Once you're through the cricopharyngeus, it's fine. There is a learning curve in that, but once you've got it, you've got it. The other thing that I find useful is to give the patients local anesthesia with topical lidocaine or xylocaine, because that just makes it a little bit more comfortable for the patients. The other thing when I'm using HALO90 is the angulation of the scope. It's called a 90-degree device, and therefore you'd think that actually you could do 4 treatments and 4 quadrants and you get the whole circumference. It actually takes about 6 treatments to get circumferential mucosal ablation with the HALO90. The times that I use the HALO90 are if I have a very short segment of Barrett, so I'm just treating the gastro-oesophageal junction, or if I have a patient who has got a very tortuous esophagus. If you use the HALO360, what will happen is there'll be one area which tends not to have been properly treated. One of the other values of the HALO90 is to treat patients who have a tortuous esophagus. So if you imagine the HALO360 is a straight device and you have a tortuous esophagus, there's going to be one wall which may not be adequately treated. Of course, one of the ways of avoiding that is to suck before you do your HALO360 so that the entire esophageal mucosa falls onto the balloon. But nonetheless, you often see skip areas, and the HALO90 is very good for touching those up. The one thing I would advise is if a patient has a tortuous esophagus, to do a HALO360 the first time round, and then come back and do the HALO90 to touch up, rather than trying the HALO90 first off. To do 6 treatments every 2 centimetres on a segment of Barrett's more than 2 or 3 centimetres long is hard work, and generally not as efficacious as doing the HALO360 first, and then come back and do the HALO90 to touch up later on.